Greetings, I'm Dr. Christy Williams, a board-certified dermatologist at Adult and Pediatric Dermatology. I'm excited to share some fantastic news with you. As dermatologists, we know that hair loss is more than just a cosmetic concern. It can deeply impact confidence, emotional well-being, and overall quality of life. That's why we're so excited to welcome Medi Tresse to the AP Derm family. Their expertise in both non-surgical and surgical hair restoration allows us to offer our patients the most comprehensive and effective treatment options available. This partnership is a huge win for you, our patients. This partnership means that when you come to us with concerns about hair thinning, excessive shedding, or scalp health, we can work seamlessly with the specialists at Medi Tresse to develop a personalized treatment plan. Whether it's preventative treatments, rejuvenation treatments like PRP, or surgical solutions such as hair transplantation, we're committed to finding the right approach for you. Together, AP Derm and Medi Tresse are setting a new standard for hair loss treatment, one that prioritizes medical expertise, science-based innovation, and most importantly, our patients. We're so excited about what this means for your care, and we look forward to helping you feel confident in your skin and your hair. Now, let's get into this webinar where you'll hear from Medi Tresse's Medical Director, Dr. Mary Wendel.
Hi, my name is Dr. Mary Wendel. I am the Medical Director of Medi Tresse, the Center for Hair Rejuvenation for Women and Men. I'm so happy that you're joining us this evening for this live webinar. We have going to have a live question and answer period at the end of the webinar where we can answer your questions. There's a Q&A section on the webinar. Just add your questions and we'll hopefully get to most of them, if not all of them, time permitting. I also want to inform you that for all of you that are joining us this evening, you will be entered into a giveaway for a free laser cap, which is almost a $3,000 value. It will be a giveaway for anybody that is listening to the webinar this evening. In addition, if you sign up for a consultation within 48 hours of the webinar and end up deciding on treatment, particularly PRP, you will be able to have a $500 discount on your 3 series of initial treatments with PRP. So again, thank you for joining us, and hopefully we can offer some services for you in the near future. So in terms of what we do here at Medi Tresse, this is a medical clinic for hair restoration. It's important for us to understand that hair loss or hair shedding is not a diagnosis, it's a symptom of an underlying problem. So here at Medi Tresse, we do a complete evaluation of the hair health and the scalp health. It involves a medical history, a hair loss history, and family history. The evaluation also includes a trichoscopy, which is an examination under a microscope, which allows us to see the hair and the scalp and helps us understand the causes of the loss. Once we see what's going on with your hair, and sometimes we order blood work, we make a diagnosis and your treatment is based on that. So everybody's treatment is not the same. It's based on your diagnosis and your medical history as well. There are many things that can contribute to hair loss or hair thinning. The most common is genetic. Many of us inherit the tendency for developing hair thinning over time. Age is a big factor. We all tend to lose our hair as we get older at different rates. Nutrition plays a big role. A lot of people are on special diets or medication to lose weight, and that can also contribute to some loss. Medical history, there are many illnesses, not just COVID that people have heard about, but any significant illness post-surgery can cause loss. Hormonal changes are very important in women, postpartum, a lot of hair loss at that point. And then there's also post-cancer treatment. We see a lot of patients come in who've had cancer diagnoses and treatment, and their hair tends to thin afterwards and not completely recover. And we do take care of those patients as well. In terms of treatment options for hair loss, we do have different options. Again, dependent on the diagnosis will determine the treatment plan. The treatment could include PRP. We have standard PRP as well as painless PRP. It could include laser therapy, could include medications, both prescription and supplements, and solutions to the scalp topically as well. So the treatments are variable and depends totally on the diagnosis once the full evaluation is completed. A lot of people have heard of the term PRP. So what is PRP? It stands for platelet-rich plasma. Basically what that means is a treatment with PRP, we utilize your own blood. A blood sample is taken and then it's spun down in a centrifuge and separated. The part of the blood that has the platelets in it is surrounded by growth factors. So when you place that PRP solution in an area of your body, it does stimulate cells to grow. And when we do it for hair, it's put right near the hair follicles, and so it does stimulate follicles to become healthier, to grow better hair, to grow better tissue surrounding the hair follicles and make the hair better. There are two ways of doing PRP. One is with injections, and the other is painless. The painless is a new procedure that we do here, as well as the standard with the injections. Either way, the solution gets placed near the follicle to stimulate better growth. Almost all types of hair loss can be treated with a PRP. That doesn't mean every patient is a candidate. We do have to consider underlying health issues, which sometimes can interfere with the ability to get PRP. But most hair loss conditions can be treated with PRP. Most commonly with androgenic alopecia, which is the inherited form. Virtually all those patients can be treated with PRP. We do also treat alopecia areata when it's a limited case with PRP and do have success with that, as well as newer diagnoses of scarring alopecias. Again, milder cases can be treated along with other types of medications for scarring alopecia. So virtually any of those diagnoses, something like traction alopecia, which is due to hair styling, can also be treated with PRP. Almost anybody who's experiencing some degree of hair thinning is a candidate for PRP. There are very few patients that will have a medical diagnosis that might prevent them from being able to have PRP, or on medications that might prevent it. So we do monitor treatment very carefully, and we do screen our patients very carefully. That's why it's so important to have a good clinical evaluation and diagnosis before PRP is started. But almost everybody is a good candidate for it. There's very little downtime after PRP treatment. When we do it with injections with needles, there can be some swelling and some discomfort for the first few hours after. But in fact, by the next morning, you can wash your hair normally and head out the door and go back to your usual activities. With the painless PRP, the hair tends to be a little bit wetter. We don't want to wash that solution out because it has some growth factors still even on the outside of the scalp. So we want to leave those there to get absorbed. And so we don't wash the hair immediately afterwards, but by the next morning, it's fine. So it doesn't hold you back, and it's pretty much painless. Particularly the painless variety is totally painless, but we do have to leave the hair alone for about 12 hours. I just want to thank AP Derm for being a part of our team here. It's exciting to work with them. It's a great combination of providers who can help virtually all patients experiencing hair loss. We have a variety of treatments available, both geographically and technically in this area. So I think that with that kind of knowledge and the experience of the providers, we are able to provide great care for virtually all of our patients throughout AP Derm.
Wow. I am honored and thrilled that so many of you have decided to join us this evening. We will do our best to answer as many questions as possible, but it's an incredibly large group. I don't know that we'll get to all of them, but I will answer what I think probably are the most important ones as well. But I'm so glad that you all joined us. So let's just get right into it. Okay, all right, so the first question, what makes PRP different here at Medi Tresse and what makes it painless? We've been doing PRP for 10 years, and initially we did it in what is considered more of the standard method, utilizing needles and spinning the blood down. But through the last really almost the entire 10 years, we have tried very hard to improve our methodology, and we have found what we believe the best systems, the best centrifuge systems that provide the greatest concentration of platelets. Plus, we have, in the last 5 years or so, been doing painless. We still do it with needles, and we leave it up to the patient to decide what they feel is best for them. But the painless utilizes a high flow intensity solution. It's still PRP. It's the same PRP solution. We optimize the platelet counts with our own platelet counters here, which I don't believe is done anyplace else around here. And so we know that we get enough platelets to provide the best treatment and the greatest number of growth factors. But the painless PRP uses a machine called a jet peel, and it utilizes high intensity flow called jet flow. And the flow comes through so forcefully, it's painless, but it still gets through the skin to the level of the hair follicle. So all those growth factors get to where they need to be. And I've had both the painless and the needle PRP done, and the painless, it truly is painless. And it is still the exact same PRP solution with the optimal number of platelet counts. We call that optimal platelet count PRP because we are able to check those platelet counts and make sure the concentration of the platelets and the growth factors is at the best that it needs to be for good growth. The next question is actually kind of a common styling question. I'll make it quick. Does hot heat ruin your hair? What it does is it dries it out and it makes it brittle, but it shouldn't actually cause it to fall out, but it will make it break off. How many PRP treatments does someone need, and when do you see the results? A great question. The standard of care for PRP is initially 3 treatments that are 1 month apart, and then followed by generally every 6 to 12 months, you should have a booster. These treatments, again, like any medical problem, treat the problem, they don't cure the problem. So generally we see results within the first 4 to 6 months, and we see growth as early as, let me get to this question real quick. This question just popped up. If you're interested in a consultation, please just click yes, and so it'll put you on a list so that we can contact you, and I'll get back to the other question. If you could just put that through. Thank you. And then again, we need a booster in 6 to 12 months, depending on each individual. Again, we monitor you very, very carefully with our trichoscopy and our photos, which we do at every single visit. So again, results can be seen as early as 3 months, but usually by 6 months, we're seeing significant improvement. But again, boosters every 6 to 12 months. Okay. If PRP is not the right treatment option, what other options are there? Great question, because not everybody wants PRP. And again, not everybody is a candidate, as I mentioned in the webinar. So if we feel that you are a candidate, but you don't feel like it's something you want to pursue, there are other treatments that are also beneficial, including laser therapy. There's medications, including low-dose oral minoxidil. And I'm referring to the most common cause of hair loss here, which is androgenic alopecia. The other types of hair loss, which is traction and sometimes alopecia areata or scarring, they require prescription medications as well. So every person is different, and we come up with a clear diagnosis with every single patient so that we know what treatments are an option for the patients. And then as a team, we decide with you what you feel will work best for you. There are also topical treatments, which I didn't mention, like topical minoxidil. And there are other also, sometimes we use compounded solutions, which can have other medications in them as well. Again, depending on your diagnosis, it changes significantly depending on the diagnosis. Okay. What is your experience in performing PRP? How many treatments have we done? We've been doing this for 10 years. We have several well-qualified, highly trained clinicians here. We've done over 7,000 PRP treatments. So we're very experienced. There aren't many places that do as much PRP as we do. We're very proud of that, by the way. And again, what are the expected results from PRP and how long? I mentioned before, when we do a series of PRP, we do 3 treatments once a month for 3 months. Even at the end, at the 3rd treatment, sometimes we're beginning to see some improvements, but certainly by 6 months, we're seeing improvement. And we have you back by then. We keep track of you. And the expected results are that PRP can increase your hair counts. What happens with androgenic alopecia is you actually get thinning of the hair strands. PRP can help thicken those strands. It also improves the tissue surrounding the hair follicle. So you have an environment that is best and better for providing nutrition and everything that the hair follicle needs to provide a stronger, better hair strand. So we see the number increases as well as the width and the depth of the hair. What are the risks and side effects from PRP? The risks, if you do painless, virtually, again, it is painless. There's no discomfort afterwards. With the needle therapy, if you choose to move with that one, you can have some discomfort after. The scalp is numbed, like at the dentist, and so it can be a little tender for a few hours after, and even for a few couple days, it might be a little tender if you touch it. There can be a little bit of swelling with the needle form of PRP. With the painless, there is virtually no swelling. So the side effects are minimal. Again, we've done 7,000 treatments, and I can't think of a person who had any significant negative side effects other than some tenderness or a headache that might last a few hours after, particularly with the needle, not with the painless. Another question, is PRP better than a hair transplant? Which is a great question. Hair transplants aren't for everybody. We use hair transplants more for men than women, and there are some reasons for that. Women want more hair. Men who are losing their hair tend to be satisfied with a density that might not be as good for what is considered satisfactory for a woman. So for women, and again, it depends on the donor hair, which comes from the back that generally then is transplanted in the front. So it depends on your donor hair, and it depends on the type of hair loss you have experienced. It varies. There are different techniques of doing hair transplants. And again, all of that comes into the discussion in terms of what is best treatment for your hair loss. So it's different. Hair transplants, we don't do as many on women, but if you have a more focal area, particularly in the front that you want thickened, hair transplant can be an option, but PRP sometimes can give you the same result. So, it's a long discussion in terms of what the patient's expectations are, which is also very important to discuss, but the treatments work differently. Hair transplant, the hair is permanently there. It shouldn't fall out. PRP is something that you need to continue to do every 6 to 12 months, even after the first initial series. So I wouldn't say one is better over the other. It's different. And how do we track treatments? We do photos, very close up photos. We also have our trichoscopy machine does what's called hair metrics, which can measure hair size. It can measure hair density, how close the hairs are, how thick they are. Are we seeing improvements over time? Is the scalp healthy? We can see that as well with the trichoscopy. The scalp can be magnified up to 200 times if necessary. So we are able to actually get numbers that help us determine if treatments are working or not. What is the most common cause of hair loss? The most common cause is androgenic alopecia, which is the genetic form. It's a very, I truly believe the majority of people have some degree of androgenic alopecia. You know, people quote statistics of 50% of men, 30% of women. The numbers are really much higher than that. You inherit a tendency for it, and the numbers are very high in terms of the number of people who are affected by it. Doesn't mean everybody has the same degree of loss. Women, it tends to occur a little bit later in life. Men, it tends to occur a little bit earlier, but it is the most common. Again, trichoscopy, again, is a magnifying machine, which allows us to get really close to the follicle to see if there's anything else that might be contributing to the loss. It gives us an idea of the health of the scalp. Is that affecting it? Is the tissue healthy? Is anything else? Are there infections there? Or is there a buildup of oils or skin or scale? Or, I mean, it makes a huge difference in the diagnoses. There are some causes of hair loss that cannot be diagnosed without trichoscopy. So if a magnified image is not being taken on your scalp, we can't be certain of the diagnosis. It's incredibly important. And we keep those photos. They become part of your record. Does it matter when to start treatment? You know, there's no question, particularly with androgenic alopecia, really any cause of hair thinning or hair loss, the earlier that you start treatment, the better likelihood you're going to get a good result. And it's hard because we see people come in very early, which is great. You know, a woman in her mid-30s already notices her ponytail is getting smaller, used to be thicker, she's shedding more. You know, we like people to come in as early as possible because it's easier to save hair follicles than to stimulate them to come back, although we do, but it takes less effort to start treatment early. So it is important. Are your consultations free? Our consultations are not free, and I would love to say that your insurance is going to cover all of your treatments for this problem. They're not. Insurance doesn't cover treatment for hair loss, even in our patients who've had cancer. And we have many patients, young and old, who are here getting treatments for their hair loss secondary to their chemotherapy, their radiation therapy. Their insurances don't cover any of it. And so it's important to understand that. Insurance will cover prescriptions, they will cover blood tests and other types of testing if necessary, but they won't cover the actual treatment. Our consultations are not free. Our consultations are $150. And if you choose to move forward with treatment, whether it's PRP or laser, that fee will go towards that. So if you choose to have treatment, then the consultation is free, but because that payment does go towards your treatment. But you get a full hour. That's important for us to let you know. Our consultations are 45 minutes to an hour. We do such a thorough history. We have you fill out a form that gives us as much information as we possibly can. We try to gather any previous blood work or biopsies that you might have had. So it's a full, thorough examination for 45 minutes to up to an hour. And the photos are taken, the trichoscopy is done. So it's not a quick in and out. It's a long, thorough evaluation. Where is APDerm located? There are APDerm offices all over New England. Medi Tresse, we are located in Worcester and in Wellesley. We may be in the future expanding those offices and the availability, but for now we are just in Worcester and Wellesley. Oh yes, we're also in New York. So if you have any friends or family in the city, right outside the city, we do have offices there as well. Equal to what we do here. Somebody said they felt that they were told their hair loss was too severe. There are very few people that won't get some benefit from treatment. As I mentioned, just a few questions ago, the earlier you start treatment, the better. But there are some diagnoses that are harder to treat than others. And if you come up really late, treatment may be hard. But we never send anybody away and say, there's nothing we can do for you. So I think that, I don't know what your situation is. I think it's still important to look for a solution. And the other thing that's important is part of treatment is not only try to get hair to regrow, but to stop further loss. And so even if we're not able to regrow your hair back, most people, we can stabilize the loss and prevent further loss. That's not true with everybody, but that's our effort, and we work hard to make that happen. How do you deal with hair loss due to medications that you need to take? That's a great question. I take medications. I have androgenic alopecia. I do a lot of treatment to try to maintain my hair. Do I think it works? Absolutely. Do I think a couple of my medications might be contributing? Yeah, they might. If you look at potential side effects of almost a lot of medications that people take, can potentially make your hair thin a little bit. But I don't believe, with a few exceptions, I don't believe that prevents you from having treatment for your hair loss. And I don't think people should stop medications that their doctors have told them they need. So generally, it doesn't mean you can't get benefit from other types of treatment for your hair loss, but I don't tell people to stop their medications because of their hair. I would not stop mine, and I wouldn't recommend you to either. What causes hair shedding? The list is endless. Hair shedding is very common. It can occur early on with androgenic alopecia, which is the genetic form, illness, COVID, any kind of acute illness, surgery, weight loss, again, medications. The list is very long. Inflammation in the scalp, autoimmune disorders, thyroid disease, hormone imbalances. That's why it's so important to get a good evaluation, because the list is very long and you need someone who knows what they're doing and is an expert in this field. Because again, hair shedding, hair loss is not a diagnosis, it's a symptom. And so our job is to figure out what the cause of it is. Somebody said their audio has stopped working. I hope that's not true for everybody. We will look into that. Somebody again asked, is any part covered by the insurance? Again, some of the evaluation is covered by the insurance. Blood work, medications are covered by insurance. Some testing can be covered by insurance. PRP, unfortunately, is not. We have patients who have flexible spending programs through their employer. They can utilize those programs sometimes to get their PRP or lasers covered. So we do work with patients with that. What? I'm sorry? Oh, I've been told the audio is working. Great. Is there a certain time of the month that's best to do blood? No, it doesn't matter. You can get, somebody asked, what blood tests do you do? Do you check vitamins, iron? Yes, we check all of that, particularly depending on your medical history, what your medical problems are. If you have a history of anemia, if you're on thyroid medications, we do check all of that. Yes, it's very important. If you've lost weight, people on medications for weight loss, they can be vitamin deficient. If you have a special diet, if you're a vegetarian, if you're vegan, again, medications can alter your absorption of certain nutrients. All of those things are important to check. Somebody asked, where are the consultations and treatments? They're here in our office. Again, Wellesley or Worcester, and then in New York City. Somebody asked about autoimmune disorders. Yes, they can cause hair loss, and they can be a really tough challenge to treat. Doesn't mean it's not worth trying. And usually we can stabilize loss. In autoimmune disorders like lupus, scarring alopecias, generally the goal initially is to stop further loss. And then with a little extra work, if we can stabilize the loss and get the inflammation under control, sometimes we can get some regrowth. So it's definitely worth trying. Somebody asked, do you do a biopsy of the scalp? Not always, not frequently, because again, we do such a thorough evaluation. We have the trichoscopy. A lot of times we don't do biopsies. We probably did more a few years ago, but honestly, with the trichoscopy and with our experience here, we're seeing so many different types of hair loss that we don't always do a biopsy. I would say less than 5%, probably 1%. Up do we do a biopsy, but sometimes it is necessary, and we are capable of doing that here. Let's see. Oops. Okay. Great question about biotin. Does it stop hair thinning and increase hair growth? Biotin gets a lot of enthusiasm for hair regrowth. It probably has some limited benefit, but maybe not as much as people have hoped for many years. It's just one small factor in things that can be taken to help your hair be healthier. But again, there's been a lot of talk about biotin for decades, and it may have some benefit, but it's not certainly not the most important part of treatment. Okay. Somebody asked about PRP after hair restoration surgery. We do it, but again, it's a personal decision between you and your surgeon, and that's who you really need to discuss that with. It sometimes can help stimulate the growth to happen faster and help get a slightly better result, but it's not for everybody. Not everybody who has a hair transplant should have PRP. So that was asked by a patient who's had a hair transplant. I suggest you discuss that with your hair transplant surgeon. Somebody just said they had a biopsy that came back positive for alopecia, but again, alopecia is a term that just means hair loss. It's not specific to a particular type of alopecia. So again, the question was, can it be reversed? And again, depends on the type, and usually most types of alopecia can be treated. So I can't answer your specific question, but again, the term alopecia just means hair loss, and it's not specific for any particular type. What is my take on oral minoxidil? Oral minoxidil does have some benefit, maybe a little bit more benefit than topically, but topically does work. It is not it's part of our treatment plan for a lot of our patients and should be considered because it's been studied for decades and has been shown to be beneficial. We use extremely low dose oral minoxidil. It is very well tolerated. The side effects are very, very minimal. But like any oral medication, you have to consider benefits versus risk. It's not for everybody. Patients may have medical issues that prevent them from taking oral minoxidil. Somebody asked, does it age prematurely? I don't know the meaning of that question. But anyway, if you are on any type of minoxidil, whether it's topically or oral, and you're on it for, I would say, greater than a year, if you stop it suddenly, you will have some shedding. So when you make the decision to use minoxidil, think about it carefully. As long as you're not having any side effects, it's something you want to stay on long term. Okay. I think I addressed this question already. Somebody asked, you have to continue to get PRP for the rest of your days. PRP, again, it treats the problem, doesn't cure it. So even once the initial series, if you have a good result, you're going to need to get boosters every 6 to 12 months to maintain that, to keep it under good control. Let's see. Again, PRP is not a permanent solution. Another good question, and we see this, and it's frustrating. Patients will have PRP, they get a great result, and for whatever reason, they choose not to continue with their boosters. And we are seeing people come back a couple years later, they've lost their benefit, and that's heartbreaking because they've spent the time and the energy and financially put the commitment to get the PRP and got a great result. But life happens, and so some things may interrupt, whether it's health or financial or whatever. Life happens, and sometimes people may not be able to continue, and you'll maintain that benefit for a period of time. But again, most people within a year or two of stopping their PRP will lose the benefit that they've gained. Okay. Some tough questions. I've answered a lot of them. There's hundreds of questions here. I'm never going to get to all of them. So I'm just going to kind of go through the ones that I think a lot of people might be interested in. Somebody asked the best treatment for lichen planopilaris. That's a scarring alopecia. There's no one best treatment, which sounds like I'm evading the question. But in fact, a lot of these types of alopecia, particularly the scarring, it's a combination therapy. And so what works for one person may not work for another. So we do focus on treating the autoimmune part of that disease and also stimulating hair with things like minoxidil and steroids and laser to try to stimulate growth while we're getting the inflammation under control. It's a complicated diagnosis and it requires multiple treatments, unfortunately. Somebody said they had Mohs surgery, which is surgery for a skin cancer on their frontal scalp and have an area where there's no hair growth. And can PRP correct this defect? That's an excellent question, because unfortunately what you have is a scar. Scars do not grow back hair for the most part. And so PRP is not likely to correct that deficit. But what might help that is a small area of a hair transplant, which they can sometimes put where there is scar tissue. Again, you need a good experienced hair transplant surgeon who's done this and knows how to do it into scars. But sometimes that can fill in, and we do that here. Somebody asked, do the tests cost anything? Those tests should be covered by your health insurance. The lab will take your health insurance information, and most blood tests are covered by health insurance. Okay. Oops. I've answered some of these already. The painless PRP, I may can be a little bit more clear on that. The PRP, and somebody else asked about the actual technology of PRP. We do a blood test, much like you go to a lab and have blood tests. So we draw the blood and we spin that blood down in a centrifuge. And so the levels, the blood is separated and there are different levels. And within one of those levels are the platelets. And that area where the platelets are, the growth factors hang out. And those growth factors, there's dozens of types of growth factors, and they have the different jobs, and some of them grow better tissue surrounding the hair follicle. Some of them actually have stem cells, which stimulate the cells themselves to grow. There's dozens of types of growth factors, which will stimulate cell growth wherever you put them. So you can do it with a needle. And with a needle, you do numb up the scalp. So we take that platelet solution out, and we also check a platelet count so that we know we can concentrate it to that specific amount that science has told us is the best amount for getting hair to regrow. So then we can place it into the scalp around the hair follicle with a needle. The scalp is numbed first, much like at the dentist, and then the needles are placed in the area where the treatment is going to be done. And the PRP is then injected to a level of where the hair follicle is. The jet peel, which is the painless, is a very high intensity flow. It's incredibly high intensity. It doesn't hurt, but it does pass through the skin, fortunately, to the level of the hair follicle. It doesn't go much beyond that, but it does get to the level of the hair follicle. So the PRP solution can get to the follicle two ways, with the needle or with the PRP jet peel. And so you have those two methods, and the results, we can get the PRP there. Again, it's optimal platelet concentration. That's really important to know, because science has told us there's a specific concentration which works best to regrow hair. And we know with our technique, with our platelet counters, that we can concentrate our PRP solution to that level to get the optimal count that will allow the hair to grow best. We use it with the painless, with the jet peel, and we use it with the needle PRP. Would I be able to style and color my hair as usual normally during PRP? Yes, you can, but the timing is important, because we don't want you to get your hair colored the day before you have a PRP treatment. So if you choose to have PRP, we discuss that with you, and we schedule it so that it doesn't interfere with that. And there's some pre and post care things you need to follow, which include, not using minoxidil for a day or two before and for a day or two after. So anyway, there are some timing issues that can be important if you have PRP, particularly if you color your hair. Styling doesn't matter. You can style it the next day, but coloring does matter. Oops. Okay. Do supplements like Nutrafol really work? That's a great question. We do recommend supplements for a lot of reasons because the quality of our food is not what it used to be, and research has shown that. Some recent studies on the nutritional value of our foods is pretty poor compared to 50 years ago. And a lot of people are on special diets and they're losing weight, which is good, but it may not be done in the healthiest of manners. So supplements like Nutrafol, we have our own series of supplements which also provide all of those nutrients and a little bit more. They do help, and studies have shown that they help. But again, it's not the only thing that's going to help you. It's really considered sort of a supplement. It's a supplement. So it's a supplement to your other treatments. It's not going to be the only treatment for you. We have gone 30 minutes. Let me just hold on a second. I'm relying on my technical person to help me here. There are over 200 questions here, and I'm so honored that you have so many questions and so much interest, but I can't possibly get to all of them. And so given the time constraints and the numbers of people that have interest, I really encourage you to reach out to us and consider getting a consultation. We lost that part. Yeah, I'm just giving some information which I need to remind you all of, which is that you will get a text actually following the end of this event, which we would like you to text back the word DERM, D-E-R-M, capitalized, if you want to be contacted for a consultation. And if your questions are great, there are some really involved questions that I've sort of scanned through. I just don't have time to get to all of them. Okay, yep. And so I just really encourage you to sign up for a consultation and get those questions answered for you in a one-to-one basis. My staff is incredibly knowledgeable, incredibly well-trained. I'm very proud of them. I'm proud of the work that we do. We've worked hard to provide care for our patients. We provide a lot of support. We know hair loss for women and men can be very emotional and heartbreaking for a lot of people. And so we understand that. And we allow ourselves the time to answer your questions. And, we have that ability to do that here. So please consider coming in so we can, get to know you and get to answer all of these great questions. Hair loss is, I think it's becoming more common. I know that people are more aware. I think COVID allowed us to be more aware. So many people lost hair, myself included, after COVID. I think it just brought awareness to it. There's more autoimmune disorders, which is the scarring alopecias, the lichen planopilaris, and the alopecia areata. A lot of those actually worsened during COVID. Stress, all of those things play. Nutrition. I mean, the list is endless. I said, somebody asked what causes shedding, and the list truly is endless. I don't mean to make light of it. It's real. So again, if you didn't click on that one question that popped up, but just know that you will get a text at the end of this program, and to please text back DERM if you'd like to be contacted for a consult. I want to remind you that there is, if you do have a consult, if you do come in for a consult and you choose to move forward with treatment, there will be a $500 discount on your treatment. By joining us tonight, you will be included in that. Does that include the laser cap? Yeah, it's a $500 discount that would go towards PRP as well as a laser apparatus. So please know that if you choose to move forward with a consultation, that is open to you. We will also be having a drawing for a free laser cap. I didn't get to talk about laser very much, But again, if that's something you're interested in, please, come in. I believe lasers do help. I think it's a combination therapy that works best. PRP, a lot of our patients will do combination therapy of PRP, laser, minoxidil, meds, supplements, or some combination of that works for them. And again, depends on the diagnosis, depends on the individual, depends on your commitment. So all of those things play into it, and it's important to have those discussions with someone who has really good time to be able to give you. I think I wish I could answer all of your questions. There are hundreds of unanswered questions, and I deeply apologize for not having the time to do it, but it's virtually impossible. But you've got some great questions there. Please consider coming in if even if you've had an evaluation elsewhere and you're not getting the answers that you need, or you're not feeling like you're getting the results that you need. Come in and talk to us. We do hair transplants here as well. Not me. We have 2 hair transplant surgeons and a whole team. But it can be part of the treatment plan for a lot of patients. And again, I am honored and amazed at the turnout tonight. I think it just shows the importance of this issue. Again, it can be very emotional for women and men. I mean, we see men coming through that are also very distraught. And so, they feel like their appearance will affect their job, their relationships. We understand all that. It's not easy. So again, I thank you so much for coming and attending this webinar. And, again, hopefully we'll get to see some of you in the near future. We're here and excited about what we do, and we hopefully will see some of you. So thank you and good night. Thanks.